everybody. Welcome in. I'm Dr. Marianne Pinkston with The Better Life with Dr. Pinkston. And today I have a fantastic guest that I want to jump straight into because we got a lot of great information to give to you today. I want to talk a little bit about ADD, or attention deficit disorder, which has been more and more common over the last, decades. And I think I understand why, but it is a very common misdiagnosis. And so I am bringing in Zachary Hinson this morning, who is a representative for the Therapeutic Justice Foundation here in San Antonio, Bexar County. We're going to talk a little bit about that and give you some information about an up-and-coming gala that he's helping to arrange with Judge Al Alonso, the esteemed Judge Al Alonso, Honorable Judge Al Alonso here in San Antonio. But we really want to concentrate on the misdiagnosis of ADD. Not that it's an inappropriate diagnosis. There are people with attention deficit disorder, lots of children, that we manage, but whenever people are diagnosed as an adult, it's a very common misdiagnosis, commonly mistreated, and this comes from your physician. So I want you to tell your story briefly. I know you were on previously.
Yeah.
Thank you for being on again.
Thanks for having me back.
Absolutely, because you've got a very important story. So briefly tell us kind of what happened to you so we set this up, people understand.
Yeah, okay. So I come from a great home, a mom and dad who loved me and did their best with what they had. My father was an alcoholic, but he did the best that he could with what he had. My mother was very sweet and kind and loving to me, and I'm so grateful for both of them. That comes into play later. So, because I have a propensity for addiction. So
it's in the family, so right?
Yeah. So it's inherited to some degree.
Yes, it is.
Right? Okay, so that makes me feel a little bit better. Yeah. But what happened was when I left for college from home, I wasn't really sure what to do. I didn't really know what I believed with what I wanted to do with my life, but about God, about everything. Just right. I started questioning everything because now I'm on my own. And me personally, I didn't do so well with that struggle. And eventually eventually I came to live with a roommate who introduced me to a pill.
Very common.
He noticed I was kind of depressed. He said, "Here, try this." I said, "What's that?" He said, "It's called Vyvanse. And it might help you. And at first I was really afraid. Like, is it going to mess with my heart?
Sure.
Is it going to mess with something? He said, no. Eventually I took it and I said, wow, this feels pretty good. So it feels very good.
Right.
How do I get more of this?
Right.
Basically. And so I went to a doctor. And what's really interesting is that doctor, I had heard would prescribe Vyvanse or Adderall or
right.
more frequently than perhaps other doctors.
Sure.
And he did. And when I got to his office, he was very awake and very excited about all the wonderful side effects of these medicines.
Right.
And he had some trouble with his practice. He's got some legal troubles going on with his practice.
Sure.
But, that's just people are against his way of treating people. So I was prescribed, and at first I took it normally.
Sure.
It made me feel wonderful. It made me feel like paying attention in class where I didn't before. It made me feel like I was motivated, like I knew what I was doing. I knew I wanted to be X, Y, and Z. I knew what I wanted to do, finally. But one day I took 2 instead of 1, and I never went back.
Right.
And I became a typical drug addict.
Sure.
I got pulled over by police. I had to go to rehab, and now I'm 3 years clean.
Yes.
And still trying to make sense of all of it.
Absolutely. Well, and I hope I can help in that regard. I've talked some about this, and I think this is a very common tale. I think many people feel, adulthood is a huge door to walk through when you've been pampered and well taken care of. And
that's for sure.
And I think more and more we have issues with depression, with addiction, depression, and, you need a lot of guidance, and there's not a lot lot of guidance out there. And so, walking through the door of a physician, you expect to have an appropriate diagnosis, right? And get an appropriate treatment. When you're given something like this, I think there are many times where it does give you a lot of alertness and focus and direction. And it is that kind of adrenaline push that these medications, they're amphetamines, and so it's an adrenaline push that these medications can give you, make you feel a lot better, kind of a false sense, right?
Right.
Because as soon as the medication wears off, then all the other things come flooding back, right?
Yeah,
and
this works. I want to go to this doctor and he'll tell me why it works and why it's a legitimate thing.
Right, exactly. So I think sometimes it is difficult to see the difference between the attention deficit and the focus problems that you have with depression. That is one of the symptoms, right? That when you are unable to really focus, you're feeling down, you don't feel energetic, you don't feel like getting out of bed and getting things accomplished. Sometimes you can be pushing your thoughts through jello, as a good friend of mine, Jim LaValle, says, and the focus is very difficult. So these medications can really give you a nice up. Then you can get into trouble because the ups become downs again, right? So with your experience, have you ever been able to get treated, for the depression, or did you, were you able to find a better place, better physician?
Yeah, I did eventually find a better physician. But that was after rehab. This was after everything.
Right.
Because as soon as I was addicted, I was lying about everything.
It tore your life apart.
Yeah, I was afraid they would take it away.
Right.
If they noticed that I'm having panic attacks and stuff like that.
Yes.
If I tell them that I take too much of this certain pill, they might take it away from me, and I didn't want that.
Right.
But I had a crisis of meaning. I'm sure a lot of people in my generation and generations after it have a crisis of meaning.
Well said.
We're kind of told that you can do whatever you want as long as it makes you happy. Well, define happy. Is it, yeah, great, everything's awesome, I have all these wonderful ideas, or is it fulfillment? And I didn't know the difference.
Right, absolutely. And when you live in a household, come from, I guess, a household of addiction, that is something that is, addiction is not really your fault. It is something genetic. And there can be various reasons why it occurs. And one of the things I wanted to talk a little bit about and inform people about is a genetic condition called MTHFR. So it stands for tetramethylhydrofolate reductase. It's an enzyme. Say that 3 times fast, and I'll give you a medical degree right away. It's hard for me. It took me years to do. MTHFR, though, is the short term for it. And it is an inability to process folic acid correctly. So we process vitamins. We eat a lot of vitamins in our meals and in our foods every day. And these vitamins then have to be processed into something else. We don't use them in that state. We have enzymes that process these vitamins into a different state. Once it becomes something different, then as far as folic acid is concerned, it becomes part of our ability to make our brain chemistry. So if you are taking in folic acid in a vitamin or in your foods and you're not able to convert it, then you're not able to make your brain chemistry. And so many people, and this happens in women a lot. So, and I'll step back to that in just a moment. But with the vitamin deficiency, not making your brain chemistry, many people, as they get a little bit older, begin to have problems with depression or anxiety. Some people may need medication, may not need medication, but having problems with anxiety, depression, and that can lead to addictions because you're taking substances that falsely elevate, some of your hormones and adrenalines and things like that, and make you, give you a false sense of improvement. But the inability to make your own brain chemistry, then, you become subject to all these problems, and then addiction occurs whenever you find a substance that makes you feel better. Yeah. And you get a little tolerant to that medication. So like alcoholics do, they drink at first. They can do one drink and get that little high, and then it takes 2, then 3, then a whole bottle, and you just progress through it. And the same thing can happen with these medications. Many women get diagnosed in their 30s, 40s, 50s and on with depression. They're actually in anxiety. And then they also, another thing that happens with MTHFR is you can't keep your focus very well. You have the symptoms of ADD, which is that inattentiveness and inability, squirrel. People say that they're, full of the squirrel factor. And that they're, just you walk into a room, why did I come in here? You forget a name, but you also are just unable to come up with the thought processing that you need to stay focused on your task and get things done. So you tend to start many different things. You can't finish one project. Procrastinate a bit, right? And so, so all those things can occur. So what do you do, right? It's a simple test. You can go and get this testing done. It's not always just this simple, but this is one of the fantastic things that that you can have done is a blood test. You can also do a cheek swab. EmpowerLabDX.com, which I'll have on the website. People can get a cheek swab and get their own results back and find out if they have this genetic inability to process folic acid and the MTHFR gene, right?
Wow.
So you treat it by giving yourself a vitamin, the right type of folic acid called methylfolate and methylated B12. And when you take that, you start making your brain chemistry again. Lo and behold, you get your thought processing back, your focus is back, but it also can treat depression, anxiety, and other issues. I have an example too of a young man that came to see me, this was years ago. Mom said he was a normal teenager, great, in school, very sociable. About between 16 and 18 started to deteriorate quite a bit and had symptoms of full-blown schizophrenia by the time he hit 18, completely debilitated at home and unable to socialize and couldn't finish school, couldn't graduate. Went from doctor to doctor, got a lot of psychological medications, right? Which is kind of what happened to you.
Antipsychotics or something?
Absolutely.
Yeah.
Got a lot of psychological medications. Things were helping, but it didn't really fix the underlying problem. We did the test, found out he had the MTHFR gene, put him on the right type of folic acid. Within 6 months, he was back in school, finishing school, and completely back to normal. And there are some great studies out there that show that depression can be alleviated too. So I think what I am having right.
That's amazing.
Isn't that great? Isn't that amazing? Absolutely. So I think what I wanted to kind of bring to light and bring your example to light, and thank you for sharing, because I know it must be something that's very, very difficult to talk about. This is something that is encompassed with a lot of shame. And a huge stigma. Depression, anxiety has a huge stigma, and as a society, we tend to try to deal with it in the sweep it under the rug or demonize or...
This is my problem. I don't want to bother anybody else with it. I'll just keep it to myself. This is my problem. I need to fix it myself.
Right.
And it's a burden to ask for help.
It's a burden, but it also makes you, I guess, feel incapable. You are, I should be able to just handle this. I should be able to just take care of it. Then you go to a physician who, probably doesn't really know. I think it's easy for docs to get into, insurances put a lot of pressure on us to see patients in 10 minutes. We can't sit down and just listen.
Yeah.
Right?
I always wonder about that. Like the doctor always is so brief sometimes.
Right? And sitting at a computer, sometimes their back is almost to you, right?
Yeah.
Sitting
They're typing on their computer.
And poor docs. I have to be on the side of the doctors because I am one, but I've seen what the insurance industry can do. Pressuring us to see so many patients because we get paid so little these days. We have to see more and more patients, right, to make up for it. So I have to see in 10 minutes, and then the laws of getting everything into a computer and your note down before you even leave the room, puts me at a place where I can't look you in the eye and hold your hand. I can't sit and talk with you like a normal human being and try to figure out what's going on with you. And part of the figuring out is, hey, let's get this cheek swab or a little laboratory test. Sometimes insurance covers it, sometimes they don't, but it's not that expensive, and it's certainly less expensive than having to go to jail and rehab and things like that some folks have to do, alcohol-wise, medication-wise, or in any case. But there are, I guess the point is, there are some other solutions. This is not the end-all be-all. It's not the only thing that, that you can be tested for, diagnosed with. There are a lot of things. Sometimes a thyroid disorder can be alongside, or it can be the only cause, or alongside that, A lot of women, after they have children, have a lot of postpartum depression. That can be actually a hormone disorder called estrogen dominance. Women can also have hormone deficiencies. Men can have hormone deficiencies of testosterone. And so testosterone replacement can be really, really helpful. And then vitamin D. So if you don't get enough vitamin D in your diet, which we don't, people are like, I spend a lot of time in the sun. It's like, the sun is not what makes the difference. We have to have an internal system of vitamin D functioning appropriately in order to make serotonin, one of our brain chemicals that alleviate depression. And I have been checking vitamin D levels for probably 30 years now, and I have yet to find a full 10 people over 30 years that have a normal vitamin D level just on their own.
Wow.
So these days we have to treat it, and that helps you to make a lot more serotonin. So if you feel really depressed and agitated, low vitamin D might be a reason for that too. So we can check out vitamin D levels. So anyway, we're going to be coming up on a break. Doesn't this go incredibly fast? We're going to be coming up on a break. And so I want to talk in the next side about the Therapeutic Justice Foundation and kind of what you guys do. I know there's a huge gala coming up. Looking for people to attend and for sponsors. So if anybody is looking to sponsor, we would love to have you. And so we'll talk about it in a few minutes. But I want people to know that, and I'm going to take a break shortly and talk about my sponsor, who is Magna Pharmaceuticals. Now, they make a product called De Novo plus B12, and guess what? It's methylated folate and methylated B12, which is exactly what treats MTHFR issues. And so during the break, I'll have Dr. Lesser information at magnaweb.com, where you can get this over the counter, just as easy as that. And so we'll pay homage to my pharmaceutical company that assists me. And if you want to see all of our previous shows, and even a show with Judge Alonzo and Zach, go to drpbetterlife.com. We're on YouTube, we're on Spotify, on Apple, iTunes, iHeartRadio. We're on everywhere, everything, every platform. So drpbetterlife.com. We're going to take a short break and be back in just a few minutes.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Back, everybody. I'm Dr. Marianne Pinkston here with Zachary Hinson.
Hello.
Zach, as I call him. So glad to have you in. We've been talking a little bit about ADD, depression, the misdiagnosis, and all the turmoil that comes with it.
Yeah, my mind's kind of blown right now. I'm a little bit trying to recover.
Bless your heart.
It's pretty cool.
Well, you brought up an excellent point. Just now we were talking kind of through the break, and you brought up an excellent point about how you felt about getting diagnosed and the downfall from there. Explain that.
Yeah, so it was pretty quick. I'm sure some doctors take more time than the doctor that took time with me.
Absolutely.
But, sometimes it's not always that you have clinical depression. Sometimes you got to check if how you're living. If you're living if you have friends and if you have a family and you have involvement with the community, you're going outside, you're exercising, and you're doing all the wonderful things that promote mental health, and you still have depression when you should have a great life and a great outlook on yourself, then maybe you're more likely to have clinical depression.
Absolutely.
But if you're not talking with friends, if you're not having engagement with the community, if you don't have an intimate relationship, if you aren't pursuing a goal, then maybe you're not clinically depressed. Maybe you're just living a terrible life right now. And I feel like that is kind of where I was coming from. Looking back on this 13 years later, I just remember maybe if I had talked to more friends about my problems instead of keeping it all inside, maybe that would have helped, and I wouldn't have gone on this whole thing with ADHD medication that perhaps I didn't need.
Well, though, I think, again, the stigma.
Yeah.
I see so many men that are unable to really sit and vocalize their internal thoughts and feelings. They're seen as weak.
Yeah, I visited my friends before getting married. I was going to all my best men and my groomsmen and visiting them, and I hadn't talked to them for a while. Guys don't really talk on the phone. Hey, do you want to chat?
Sure.
And I discovered that they were all going through very similar kind of dark avenues in their lives, and they felt like, I didn't want to burden you.
Right.
We all felt exactly the same. We were going through the same thing pretty much, but we didn't talk to each other.
Absolutely. Well, but you go on Facebook and everybody's got a great life, right? I mean, we tend to put our best foot forward, hoping to kind of, I think, cover up any difficulties or pain that we have underneath. I think you bring up a great point that everybody has it, and we are all the same. So, to sit down and have a conversation with friends can be a very difficult thing to do. You at least need to be able to go and sit down with your physician or your provider and have that conversation. And I think you bring up an excellent point that sometimes it's not all just a clinical diagnosis that is rewarded by taking some sort of a pill. There's a lot of stigma against taking medication for depression, and I really would like to erase that at some point. I think what the medication does is it helps your brain and it helps you use what brain chemistry you're making normally so that you feel more normal. It doesn't erase the problems. It doesn't erase any of the genetic or vitamin defects or anything underneath, but it does just help you feel more normal by helping you regulate your own brain chemistry. So it's a very safe thing to do. The problem is, what if you're not making your brain chemistry? Then sometimes they don't help.
Yeah.
A lot of times patients will tell me, I tried this medication, I tried that medication, and it just didn't work, or I felt bad. And I think the main thing to understand there is if we can treat you for some of those underlying, hormone, genetic vitamin supplement, nutritional issues, then they might work. And so it's a stepwise fashion. Then you've got to surround yourself with a lot of support, and community support is important. So tell us about the Therapeutic Justice Foundation quickly before we go, and let us know about this gala. This is very important.
Yeah. So speaking of getting treatment for what you need to be treated for, Judge Al Alonso, he was on a previous episode, so go to drpbetterlife.com.
Exactly.
And you can watch that episode with me and Judge Alonso. He's the father of drug courts in Bexar County. So what that means is he started the therapeutic drug courts in Bexar County. Yes. They exist because of him.
Yes.
And he is so knowledgeable and so wise, so captivating.
Yes.
And what those courts do is they help people get the treatment they need for their drug addiction or for their alcoholism that maybe caused them to be arrested or have that DWI or that misdemeanor charge, or maybe a veteran has some mental health issues. And, of course, I mean, if you have PTSD, then you're going to have more of a rough time with it, and maybe you'll seek alcohol to help you, to self-medicate.
Self-medicate,
That happens a lot.
Yes.
And it's no matter where you're coming from, if you're treating it with a substance, then you might have interaction with the law. And what these therapeutic courts do is they rehabilitate you instead of throwing you in jail.
Right.
Because if they just throw you in jail and you're addicted to alcohol, when you get out of jail, you're going to go right back to alcohol. So we're raising awareness for these treatment courts so that they can be better utilized in Bexar County. For every participant of the therapeutic courts that graduates, U.S. taxpayers save $6,000.
That's amazing.
Per year. So that adds up to a lot. I mean, millions of dollars. These courts really pay for themselves, and our foundation provides financial assistance to those courts.
Absolutely.
So we're holding a gala for the first time since COVID hit. We're holding a gala raising awareness and celebrating the success, the outstanding success of these therapeutic courts. We're having judges and participants are coming too who are sharing their success stories.
Exactly.
Totally captivating.
Absolutely.
And law offices, attorneys, and also vendors of the specialty courts, people who provide the services that they need and the treatment they need.
Yes.
They will all be there. So you can go to therapeuticjusticefoundation.org. A long name, therapeuticjusticefoundation.org.
It's on the website.
And it's all on the website. Individual tickets are just $100, and you can also buy a table for your business if you want to promote your business while you're there. Kind of schmooze with some professionals and advertise yourself.
Absolutely.
And get involved with the community and put your name attached to Bexar County's healing.
And this is, I have the date for Thursday, October 3rd at 6:30. It's on a Thursday. So, and in the evening after work. So no excuses. We need people to show up.
Right. And just because it's a gala doesn't mean it's not black tie. It's black tie optional.
Great.
So you can, if you dress professional for work, you can come after work. And
your Sunday best, right? So
at the San Fernando Cathedral Ballroom.
There you go. And there will be information on the website. So drpbetterlife.com. Take a look at that, and I'll have all that information there. We have hit the end button.
Thank you.
But I really appreciate you coming on, sharing your story, and talking about the Therapeutic Justice Foundation. But
thank you for having me.
Absolutely. So an important topic, guys. Everybody, have a fantastic week. We'll see you next time.